Good morning. My name is Dr. Melody Medley Keith, and I am a doctor of physical therapy. My specialty is in biomechanics, the biomechanics of how a lever system works. Our bodies are a lever system. And every month we give you these little snap-a-nars that give you some health tips for those of you that might be in pain, might have some trouble. Today, we're talking about thigh pain. For those of you that have had thigh pain so bad that you can't even touch it, the pain hurts with everything, and you're like, what can I do for relief? I'm here to say the relief is going to come in the pool. We found over years with clinical work with our thigh patients is that getting in the water and unweighting, because biomechanically it comes from the pelvis. So what you can do in the water is just miraculous. So movement is just a big issue. So with your thigh pain, as you're in waist deep water, you want to start with just moving the leg around, in and out, and in and out, in and out. And what I like to think of is that the leg is straight and your knee and your foot go in, and then your knee and your foot go out. So try to make it as the whole, because you're trying to affect here. So for those of you that have been rolling your thigh with those rollers, don't do it. What we're trying to do by getting in the water is lift the muscles up so they move freer, and they can move freer and take away your thigh pain permanently, right? So internal, external. You can also get in and do those just with walking. So when you walk, you want to walk with toes in, knees in, thighs in. But very important, posture, 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 right? Do not stick your tushy out. I want you standing up straight, pulling in your belly button, and walking with your toes in. We call these pigeon-toed walks. Just walking, walking, walking. And then you're going to walk with your feet out. We call these duck walks. And it's very important that you make sure you have good posture with these. So don't sit and try to, like that. You've got to stand up tall, stand up straight, and then work the whole leg as a unit, the whole lower quarter, in and out, in and out with proper posture techniques. Okay, so what this does is to try and help the hip joint proper move a little bit. But our next big step, once you've warmed up, again, 5 to 10 minutes of doing this. Nice and easy in waist deep water. You don't have to get in deep, deep. You don't have to get your hair wet for those of you that are a little fearful of the water. Just get in and walk. Pigeon toe, duck walks. Pigeon toe, duck walks. 10 minutes. Then you're going to get a nice big noodle. This is a very big noodle. It floats good, and you're actually going to come over and sit on it. Now, if you're very afraid, just stay next to the wall. So you're going to actually sit right on it. You can hold on if you want. For those of you that don't need, that's fine. You're just sitting on it. And what we're going to do here is just our pelvic tilts. You're going to pull the pelvis forward and back, forward and back, forward and back. And you can tell the more you do this, the more you're going to allow the pelvis to move. Forward and back, forward and back. Now you can see my feet are on the ground. For those of you that are a little more comfortable in the water, you just pick your feet up and start balancing on the noodle and try to balance, try to move. Try to get in and move. You can go forward, back, side to side, and you can also do some circles, right? If you don't feel comfortable with your legs up, put them on the ground. If you don't feel comfortable away from the wall, just hold on. But get the pelvis moving. Think pelvic movement with spinal alignment. Spinal alignment, pelvis mobility. Forward, back, side to side, and circles. And by allowing the movement of the pelvis to come back, it will take the stress off of the quad muscle and allow the quad muscle to start moving dynamically and take the pain away. I would love for you to try it. If you guys have any other questions or problems, please feel free to call us at Lakeway Aquatic Physical Therapy. We are in Lakeway, right outside of Austin. If you have any other questions or things that you would like for me to talk about in our Snap-N-Ars, just put them in the comments section. Please give us a thumbs up and ring that bell for me. Thank you so much. Have a great day.